This is John Frownfelter, Chief Medical Information Officer with Jvion, presenting on social determinants of health and AI to understand how it connects and patients that will benefit from digital health. Jvion is an AI healthcare company that's been around for close to 10 years, and we leverage the power of social determinants combined with clinical data with our 30 million patients in our database to understand clinical outcomes, to understand patients holistically, not only where they are today, but where they're going to end up. Combining those things gives tremendous insights into what actions to take for patients. The challenge in healthcare today is to proactively identify and manage patients' risks. The challenge that we have is that risk stratification and typical care pathways are not enough. Risk stratification uses predictive modeling to identify patients who are higher risk, but it does not identify patients who are the most impactable, and it also does not usually tell us what we should do. The result is then we go to care pathways that are standard care processes that are delivered to every patient. Not all of those interventions are necessary, but they can be expensive. Combining those two things do not always tell us the right patient to do the right interventions on. There's a gap there that is powered by artificial intelligence. The solution to this is to identify patients not only who are at risk, but also to identify those patients where you can modify the outcome by doing particular interventions, and to do specific interventions that will be most impactful on those patients. An example of this is a patient that was admitted for a deep venous thrombosis at one of the hospitals that is one of our customers. The patient was discharged on a blood thinner and was identified as at risk for readmission due to inability to afford the medications and due to limited transportation. Several days later, he arrived late to his doctor's appointment, and upon deeper questioning, the doctor learned that he was late because he did not have access to the family car and he had to ride in a taxi to get to the appointment, and therefore almost missed his appointment. When she asked him about how he was taking his medications, she learned that he hadn't yet filled them because he couldn't afford them. This was a patient who was at risk for being readmitted to the hospital with a recurrence of his condition. Understanding the social determinants and how those drive risk for a patient is complicated, and it requires more than understanding what the features are on that patient. It requires understanding which of those features are risk factors. Which of those social determinants are actually driving the patient's risk? Some of the sources of data that we pull from include census data, USDA food data. We also obtain claims data and clinical data from our customers. Combining all of that together to holistically understand a patient and to perceive what their risk is requires the power of artificial intelligence. All of these insights together then combine to provide action steps. In the first example, an action step could be telehealth. In the context of the COVID-19 that we are experiencing in our country right now, the telehealth regulations have been lifted and there's a flourishing for the first time of telehealth. How does social determinants drive our understanding of opportunity for telehealth? I'm going to digress for a moment, talk about social determinants and understanding those. If we understand a risk in a community at the county level or zip code level, it does not apply to the individual necessarily. It is not specific enough. And we end up assuming things about patients that are not true, or even small populations at the neighborhood level. Conversely, a lot of work can be done to canvass neighborhoods, such as census takers, and gathering that information, but it is neither efficient nor is it entirely accurate because we do not have the resources to roll that up to see everyone in that population. And so assumptions are made, and what's true about individuals is extrapolated to larger populations. With the power of artificial intelligence combined with the ability to purchase large amounts of socioeconomic data and to obtain publicly available data, those sets combined together with the power of artificial intelligence provide insights that we've never been able to have before. In contrast to the H1N1 outbreak in 2010, we did not appreciate the impact of social vulnerability on the 2 to 3 times higher mortality risk that existed in that population. You can see here in this vulnerability map produced by Jvion that there's a patchwork quilt of risk from low to high in areas all over the country. Zooming into a vulnerable rural area, you can see even in census tracts that there are higher and lower risk. In those settings, the power of telehealth is going to be particularly relevant in reaching those patients who may have trouble accessing healthcare. They may have limited transportation. Telehealth in this setting has become extremely important, both because of limited access in the rural areas, but also because of the need for distancing and having care being delivered remotely all over the country. In the next example, medication adherence is a complicated question. How do social determinants drive a person's likelihood to adhere to a medication regimen? These are the complex questions that only artificial intelligence can provide the power to answer. So we have a patient who has a number of risk factors socioeconomically, including education factors, income, food access, transportation, and there are prescription factors as well. And we see both of these things in balance. The prescription factors such as mechanisms of action or drug-drug interactions. Polypharmacy is a major concern in many of our chronically ill patients. Combining those things together helps us to understand individual level risk for individual patients. It allows us to understand how to engage with them and the power of reaching out to them in particular ways that will help to engage those patients is powered in part by AI. We might best engage one patient by reaching out to them by a phone call, another person by email, another patient by text or by internet, and some other way, surveys, etc. The way to reach them is aided and informed by artificial intelligence. In addition, even the best times of day, with levels of insight down to the person level, to understand when they're most available, what their habits might be, because of the social picture that we have about each patient. We are able to understand how to best engage patients in their medical care. In the third example, how do social determinants impact our understanding of managing chronic disease and leveraging digital health? I'll give a patient story here to illustrate. In one of our customers, there was a diabetic that we identified the patient as at risk for poor nutritional status. And the recommendation was to evaluate and dig a little deeper, do dietary education. The case manager was doing a home visit, and they were somewhat embarrassed to raise the topic because this patient happened to be a diabetic that was also a renowned chef in a large metropolitan city. But she asked the question about his diet and how he was doing. And he opened the cupboard and he said, "What diet?" And it was full of processed foods. And the challenge for him was that he was working all day providing service and making meals for others, and he had no interest or time in doing the same amount of effort and care for himself at home. And so his diet was less than desirable, and he knew it. He didn't need education as much as he needed to be motivated and reminded that he needed to take care of himself as well. Digital health could benefit this person through the use of, say, a smart app on the telephone and responding to a text while riding in the subway on the way to work, or completing calorie tracking in an app on the phone. A highly educated, highly functional individual with a little bit of support and prompting would be very engaged in this approach. In all of these scenarios, the power of combining social determinant insights with digital health technology will be powered by artificial intelligence. This is the revolution that we're heading into in healthcare. This is the way to transform, to deliver the best possible care we can for our patients, improve quality, lower costs, and ultimately bring better value. Thank you for your time and attention today. Hope you enjoyed this discussion.